May is Better Sleep Month, so we're getting under the covers for this month's cover story about a common sleep disorder that, until recently, was widely unknown. It's called Restless Legs Syndrome, and it is estimated to affect as much as 10% of the population. But as Rod Starnes reports, there is hope for these sleepy sufferers.
To sleep, perchance to dream. Not for J.R. Amore.
I was not getting very much sleep. I was up a lot. It was hard to get down. When I would get down, it wasn't for very long.
J.R.'s wife, Shawn, wasn't getting much sleep either.
He was up and down. He might sleep for 2 hours. He would get up for an hour. He'd come in here and watch TV. He would get on the computer. He'd come back and lay down, which also wakes me up.
J.R.'s sleep problems were much more than just a restless night.
I would notice right as I was falling to sleep, when I was almost in between awake and asleep state, that my arm would twitch or my leg would twitch.
When we first went to bed is when they were the worst. Just laying next to him, his body would twitch everywhere from his arms to his legs to just even like his shoulder. It was almost like a spasm.
Making matters worse, J.R.'s sleep problems carried over into the day.
I can remember, not napping, but dozing, at work, and when I was doing things that were, relatively important and things that normal people wouldn't necessarily, fall asleep on.
The sleep problems started several years ago. That's when J.R.'s doctors did a sleep study to find out what was going on. Sleep studies are usually done in a sleep lab to watch what happens to your body during rest. The studies are done to find the root cause of sleep problems. J.R.'s condition was Restless Legs Syndrome, or RLS for short. RLS has been around for centuries, but has been largely unknown and misunderstood, according to a recent study by the RLS Foundation.
Restless leg syndrome is a movement disorder that occurs before and during sleep, and it's a clinical diagnosis based upon 4 major criteria.
First off, RLS patients experience an almost irresistible urge to move the limbs, usually the legs.
And this feeling can be anywhere from the creepy crawly sensation that many people will experience to a feeling like water's running underneath the skin, or even sometimes a somewhat painful sensation. This is then accompanied by a worsening if the patient remains at rest, and an improvement if they get up and walk around. It gets worse in the evening time or at night. So what ends up happening a lot of times is the patient may try to go to bed around 10 p.m. at night, but they may not actually be able to fall asleep because of this movement problem until 1 or 2 o'clock in the morning.
So it's serious stuff, and it can be a bit confusing for patients to understand what they may or may not have. You see, there's another condition similar to RLS that's also a cause for concern. That disorder is called periodic limb movement disorder.
Now, there's a lot of overlap between these 2 conditions. One's a clinical diagnosis, the other one's a laboratory diagnosis. And many patients that have one have the other as well.
Patients with periodic limb movement disorder are usually unaware of their symptoms because they occur when the patient is totally asleep. Because of that, a primary care physician can make a clinical diagnosis of RLS by a patient's description of their symptoms. But periodic limb movement disorder requires a laboratory diagnosis, which means the patient must do a formal sleep study in a sleep lab. Currently, there's no cure for these sleep disorders, but there are ways to improve quality of life.
We look actually for medicines that can aggravate this situation. If you are on, for instance, an antihistamine such as Benadryl, may aggravate the leg movement problem.
Dr. Schreiner also looks for other causes of RLS like pregnancy, smoking, anemia, or drinking caffeine before hitting the sack. And patients can certainly treat the symptoms by taking matters into their own hands, or legs actually.
Keeping the legs warm at night may be very beneficial. I have many of my patients, I have them take a hot bath, especially in the wintertime. That warms up the legs, especially in the central muscular areas, and seems to help a bit. I have them do stretching exercises. These are all things that are pretty simple to do and may help some individuals.
For JR, medication seemed to do the trick.
The effects seem to be almost immediate. I would say within at least the first 2 to 3 nights that not only myself but my wife had noticed that there weren't any of the twitching, any of the pain in the legs.
Thanks to a good night's sleep, JR is able to get up earlier for his morning run, something he wasn't able to do while suffering with RLS.
It is a syndrome. It is a disease. It's not just something that you're going through. And I would encourage anybody to go see a doctor because there's treatment out there for it. I don't have to just live with it. I can be proactive. I can take my medicine, and then I can continue my life in a normal fashion.
And that's something to sleep on. For Smart Medicine, I'm Rod Starnes.